You're riding in the car with the Chiro. So today's topic is surgery and chiropractic. Imagine a chiropractor talking about surgery. Yes, we chiropractors sometimes have to send our folks out for surgical intervention. That's not a negative. It is exactly what needs to be done in the best interest of the patient, because not always can we solve the problems that our patients come in with. So the beauty of having relationships with neurosurgeons or orthopedic surgeons is that those relationships foster the very best care possible for you, the patient, if you're one of those folks that needs that referral. So yesterday I had a gentleman come back in who had surgery 6 weeks ago. He had been involved in a motor vehicle accident. We gave him chiropractic care for a number of months, and we hit a wall. And when I hit that wall, I said, you know what? Something's different here that I'm not seeing. And he was a patient for many years prior to the motor vehicle accident. So I knew his response level. I knew how his body worked. I knew how to take care of him. Yet something wasn't quite right. So he finally got permission to go get an MRI, and the MRI proved my thoughts, and he needed surgical intervention. He had surgical intervention and just got released 6 weeks or so post-surgical of neck surgery, and he came back in the office. Why? Because he understood before he had surgery, he understood well before he had the motor vehicle accident, the importance of maintaining your spine and nervous system. So when we talked about the possibilities of surgical intervention as I was caring for him through his motor vehicle accident, I said the bottom line is, if we have to go the surgical route, the best success you can have post-surgically is to make sure we manage your spine above and or below the surgical site so that your spine doesn't fail you, because it happens all the time with people who have had spine surgery. The area above and below now has to work harder than it's ever been designed to work, and it fails you, meaning symptoms start to come back, or new symptoms or different symptoms. And the medical approach typically is we'll do Mario. We'll do physical therapy, we'll do injections, and then again, go back to that same surgeon and they'll do another intervention. The goal is to never, ever, ever have to have surgical intervention in your life if it's possible, okay? And so chiropractic care offers you the option to maintain and manage your spine post-surgically so that you're least likely going to have surgical intervention unless, God forbid, you wind up in a motor vehicle accident, right? So I had another patient that came in. He had 2 surgeries prior to coming to my practice. He had low back surgery many decades ago, and he had neck surgery a number of years ago. And as a result, his surgeries did very well initially post-surgically. Well, guess what? Some of that stuff has come back. And as a result of it, over time, the body broke down. And in that breakdown process, because nothing was offered or done to maintain his spine post-surgically, the spine deteriorated and became severely degenerative. As a result of that, there's not a lot I can do to create massive change to give this guy the quality of life that he dreams of and that I would love to give him. So there's only so much that I, as a chiropractor, can do. But my goal with this particular gentleman is for him to avoid surgical intervention, because risks run amok with surgery. And if we can do anything we can to avoid surgical intervention, we're going to do that from a chiropractic perspective. So we're going to manage what we can and then long-term maintain that spine so it never breaks down again. That's the importance of chiropractic and surgery working together. It can happen. I have another case scenario where a guy had an injury, a worker comp injury. It happened on the job. And this is going on 4 or 5 years, something like that. He took us over a year and a half or so for him to get the lumbar surgery that he needed, trying to get the MRI, getting permission, etc. And he just went in finally to get cervical surgery from the trauma, waiting 4.5 years because the insurance company decides whether or not you can get what you need. His quality of life had deteriorated tremendously. Why? He needed it. We proved it. It doesn't make sense. So here's the deal. Chiropractors are not against surgery, medicine, medical doctors. Absolutely not. I love working with really competent surgeons and medical professionals. I work with a physical therapist regularly. He's fantastic. Why do I do that? Because I want what's best for you, the patient. What's going to allow you to get back to living the life that you desire? Well, sometimes you need surgical intervention. Sometimes you need physical therapy. Sometimes you need whatever. Sometimes you need injections. I hate them, but sometimes it's necessary to get you through the crisis so that I can get the work done that's necessary to create the change in your spine so that we avoid surgical intervention. So chiropractors aren't against surgical intervention. It's just a last resort. And if your chiropractor says we may need to have surgery, you better go and get those diagnostics done and find out. Because the sooner you get it done, the sooner you get recovery, and then get your butt back to your chiropractor and maintain your spine for the rest of your life. I said it, for the rest of your life, because if you don't, your spine will maintain itself. And that typically is not a pretty process. I see it every day in my practice when I read x-rays. So I'm Dr. Anita from Mylan Family Chiropractic Center right here in Bayville, New Jersey. You've been riding in the car with the chiro, and we're talking about surgery and chiropractic. Yeah, it does work together. I hope you have a fabulous day. Enjoy your weekend. I'll catch you on the next ride.